Good afternoon, thanks for joining us again today. I will give you the usual report on the COVID statistics. First of all, I can report that the total number of positive cases yesterday was 993. That represents 17.1% of people who were newly tested and 6.4% of the total number of tests that we carried out. And I'm going to come on later to say a little bit more about these different measurements. The total number of cases now stands at 47,708. 362 of today's cases were in Greater Glasgow and Clyde, 294 in Lanarkshire, 122 in Lothian and 57 in Ayrshire and Arran. The remaining cases are spread across the other 7 mainland health board areas. 754 people are currently in hospital, which is an increase of 40 from yesterday, and 61 people are in intensive care. That's 2 fewer than yesterday. Now, for the eagle-eyed amongst you who follow these figures very closely day to day and might have spotted that yesterday's hospital and ICU figures and today's don't exactly tally, I can tell you there's been a small revision made to the figures reported by Ayrshire and Arran yesterday, and that will be shown in the publication that will appear on the website later. I also regret to say that in the past 24 hours, 1 additional death has been registered of a patient who had tested positive over the previous 28 days. We also reported 15 deaths on Saturday, so since I last stood here to give the daily update on Friday, 16 additional deaths have been registered, and the total number of deaths under the daily measurement is now 2,610. That figure is a reminder of the heartbreak that this virus is capable of causing, and once again I want to convey my condolences to everyone who has lost a loved one. Now, I've got a few things that I want to briefly update on today. I'm going to highlight 2 points about the daily figures that I've just reported, and at the end of my remarks I will look forward to the week ahead and some of the decisions that lie ahead of us. But briefly, first of all, let me just look back. It seems clear from anecdotal reports that people overwhelmingly stuck to the rules over this weekend, including the rules on household gatherings. And that's really important. Stopping households meeting up indoors is, as you know, crucial to slowing the spread of COVID. But I'm aware that it's also really tough, and it gets tougher with every week that passes. So I just wanted to take the opportunity today to say thank you to everyone who has played a part by following the rules and guidelines. You are making a difference, and please be assured of that. Let me now cover a couple of issues relating to the daily statistics. We reported only 316 new cases yesterday, and as you can see, that's far lower than the numbers we have been reporting on previous days. Now, we're still exploring this with the UK government, but we think this might be because from Friday onwards, quite a large number of tests were diverted from the Lighthouse Laboratory in Glasgow to be processed in other laboratories in the Lighthouse network. Our understanding, although we do not control this process, is that this was to ensure that the Lighthouse Lab in Glasgow didn't handle more tests from across the UK than it had the capacity to deal with promptly. We also understand that the tests diverted included those of people with symptoms who'd gone to drive-through or walk-in testing centres, and it stands to reason these people are more likely to test positive than asymptomatic people who are being tested as part of routine care home testing, for example. And that might help to explain why yesterday's number of positive cases was probably artificially low. The rerouting of cases was due to stop yesterday, and my expectation is that any new cases which we would have expected to see yesterday will be included in the figures for today and tomorrow, although we continue, as I said earlier, to explore whether there might be any other issues at play here. Of course, this is one reason why when we consider the number of positive cases, we always look at trends over a number of days rather than at any single day at a time. And of course, our Test and Protect teams will be working to identify contacts of positive cases as soon as the information about them comes into our case management system. And I would remind anyone who may be waiting for a test result that you should, of course, be continuing to self-isolate while you wait for that. That is a really important part of our collective effort to control the virus. Now, the other point about our statistics that I want to cover relates to the percentage of people who test positive for COVID. And I'm afraid that, as occasionally happens, I'm going to discuss an issue now which is quite technical, but which is important. So please bear with me, because I always like to try and give you an understanding of what lies behind our statistics and the reasons for any change in how we're calculating any aspect of them. For some time now, as you know, I have reported here a daily figure for the proportion of people who test positive for COVID. That's an important metric that allows us, amongst other metrics, to determine whether the virus is spreading more rapidly or going into decline. And to arrive at that figure, what we have done so far is measure the number of people testing positive as a percentage of the total number of people being tested who had never been tested before. That's why you hear me say every day that it is a percentage of people newly tested. That ensures that we don't count people who are tested twice in a very short period of time. For example, if a test result needs checked, or perhaps somebody is tested both on admission to hospital and then a few days later. Now, the current measure has been helpful so far in assessing how the virus is spreading. And all of you will have seen in recent weeks in the percentage of positive cases that we've reported that the rise in that has been consistent with a rise in case numbers, in hospital admissions, and increasingly, unfortunately, in people dying. However, the way in which we currently calculate this becomes less reliable over time as more and more people in the population have been tested. We're now more than 7 months into the pandemic, and already more than 1/7 of the population of Scotland has already been tested for COVID. Under our existing measure, none of these people will ever count again as a newly tested person, someone who has not been tested before, although if they test positive, their positive result will be counted. Let me illustrate that with an example. If you had a fever in August, if you got a test then and you didn't have COVID, and then you have a cough now, you get tested again, and it turns out you do have COVID, your positive test will be counted, but you will not count as a newly tested person when we work out the percentage. So as you can see, over time, as more and more people who have already been tested go for further tests, and remember, almost 40,000 care home workers are tested every single week, what happens is that the percentage of positive tests that we report is artificially high and gets more and more artificially high as time goes on. So we've been discussing this issue in some detail with the UK's Office for Statistics Regulation, and we've taken their advice into account in deciding a new measure, and we will continue to engage with them on future improvements. Instead of relying only on people who've been newly tested, we'll now calculate the percentage of positive tests based on the total number of test results which have come in on that day. Now, that measure is simple to calculate, and it does come closer to matching the methodologies used by the World Health Organization for determining whether the virus is out of control. And it's worth stressing, though, that although it's a better measurement for this stage in the pandemic, for the reasons I've tried to set out as clearly as possible, it's still not perfect. So we'll continue to look at further improvements. And the imperfections are these. If you need to be tested more than once in the same day or the same week, all of these samples will now be counted. And in addition, the new measure, to a much greater extent than the old measure, combines test results from different groups of people. The majority of our tests are of people who have symptoms of COVID, but we also test lots of asymptomatic people every week as well, principally people who work in care homes. And those tests are much less likely to be positive than tests of people with symptoms. So on a day-to-day basis, that could lead to some fluctuations in the daily percentage. But on a weekly or monthly basis, the trend in test positivity will be clear. And our view is that the new measure will give us a better picture of the course of the virus over the weeks and months ahead. The old measure was the most accurate for the early phase of the pandemic. We think this one is more accurate for the next phase. Now, as you have just gathered, that is quite a technical change, and thanks for bearing with me if you have managed to do so. But we also want to give you a bit of time to see the effects of the change in methodology. So for that reason, and also to be completely transparent, to avoid any suspicion that what we're trying to do here is change methodology to result in a lower number every day, for at least the rest of this week, I'm going to give you both our old and new measurements when I give you the daily figures. Eventually, though, I will start to report the figure under our new measurement only. So to remind you of what I said earlier on the old measurement, taking people just newly tested, our test positivity rate today was 17.1%. On our new measurement, taking all tests, it was 6.4%. Now, the final point I want to cover is to look to the week ahead. As I indicated last week, we will publish this week detail of our new strategic approach to tackling the virus. I hope to discuss the outlines of this tomorrow with leaders of the other parties in the Scottish Parliament, and we will then publish a strategic framework at the end of the week before debating it in Parliament next week. One of the things the framework will set out are the different tiers or levels of intervention and restrictions which may be applied in future, either locally or nationally across Scotland, depending on how the virus is spreading. And we will also indicate, based on the latest advice from the National Incident Management Team and our clinical advisors, what level should apply to different parts of the country, or potentially all of the country, once the current temporary restrictions on hospitality come to an end on the 26th of October. The framework will also summarise our work to improve the effectiveness of existing measures to curb COVID, for example, how we will work to improve compliance with facts, advice and all of the other guidelines, the review of our testing strategy and how we will continue to support Test and Protect, and also how we will provide support for businesses and individuals so that they can comply with all that they are being asked to do, either now or in the future. Publication of the framework is an important step as we look ahead to the winter and prepare to manage the virus over what may well be, and I would expect to be, a very challenging period. So we hope that the framework can command broad support both politically in Parliament and across wider society. But, and this is where I will end, it's worth stressing that although the strategic framework will update our approach to tackling the virus, many of the basic elements of that approach will not change. In particular, it will continue to be vital that to slow the spread of the virus, all of us as individuals stick to all of the essential rules and guidelines on hygiene, physical distancing and limiting contact with other households. So let me just briefly remind everyone of what those current rules and guidelines are. As I said earlier, except for specific purposes such as childcare, none of us should be visiting each other's homes right now. When we do meet outdoors or in indoor public places that are open like cafes, we shouldn't meet any more than in groups of any more than 6 people from a maximum of 2 households. Only car share if it is essential to do so. Work from home if you possibly can. And again, I would appeal to employers to facilitate that for your workers. Download the Protect Scotland app if you haven't done so already. And finally, remember facts. Wear face coverings. It is now the law as of today to wear them in communal areas in workplaces like corridors. Avoid crowded places. Clean your hands and hard surfaces. Keep 2 metres distance from people in other households and self-isolate and get tested if you have symptoms. These are the basic things. No matter what other rules are in place at any given time, these are the basic things that if all of us do all of them all of the time, then we give ourselves the best chance of keeping spread of the virus under control. It's the best way to look after ourselves, to look after our loved ones and our communities, and ultimately it's the best way to protect our National Health Service and save lives. Thank you again for listening today, and thank you in particular for bearing with me through quite a long, laborious and technical update on how we will calculate the percentage of people testing positive. We'll now move to questions. I'm joined by the Chief Nursing Officer, and she and I will now take questions from journalists as always. First up today is Gordon Cree from STV.
Thank you, First Minister. I've spoken this morning to Craig, a teacher from Falkirk who had a COVID test on Friday and this morning was told that the result could take another 5 days. Now, clearly he can't go back to work without a negative result. What you've said as an explanation for this, the UK government has said is categorically untrue. So that war of words probably doesn't help people waiting for a test, but it gives the impression that someone isn't being straight with us. What can you say to people like Craig who don't have their results? And can I ask Professor McQueen what care, treatment and support there is in place at the moment for people with long-term COVID symptoms?
I'll hand over to the Chief Nursing Officer shortly. I don't know from your question, Gordon, who has told Craig about it perhaps taking another 5 days. We are working very hard with the UK Government to ensure that the turnaround times, particularly for tests that are already taking longer than we would want, are as quick as possible. But if there's more information of that, you can provide.
If I may on that, he was told when he had the test on Friday he'd get the result in 2 days, and if it hadn't come, to phone up this morning, and it was when he phoned up he was told it could be up to 5 days. Okay, I'm still not clear. It's not your fault, Gordon. I'm not being difficult here. I'm not clear who he phoned, but we will look into that later. Just on terms of, it is in nobody's interest, certainly not in my interest, to get into a war of words with anybody on this. I'm trying to avoid doing that. We are dependent on the UK Government to help us resolve some of these turnaround issues with tests that go through the Lighthouse Laboratory. You've heard me talk about that on previous occasions. We have worked with them and it has improved, and I would hope that will be the case this time as well. But when I looked at the UK Government statement yesterday, I'm not sure that they are denying or challenging the substance of what I'm saying. The statement I saw from them recognised that a large number of tests have been diverted from the Glasgow Lighthouse Laboratory to Lighthouse laboratories elsewhere in the UK. That's what I'm saying, and that appears to be what they are agreeing with. They may have taken issue with how we've described that, but that, frankly, is, in my view, less of an issue than getting to grips with the substance. And we hope that redirection, as I said, will have stopped as of yesterday. Any that have been redirected, and maybe that Craig's is one of them, we will start to see them come through the system. Obviously, we want to work with the UK Government to maximise the capacity of the Lighthouse Laboratory in Glasgow to do Scottish tests without them having to be redirected elsewhere if possible. And that is work that is ongoing constructively. Just before I came in here today, and because I only got given this information just before I came in, I haven't gone into any detail because I haven't had the opportunity to understand it in full. I was given information to suggest there may also have been a delay in the UK Government's texting service that notifies test results to individuals. But that's something I will be going from this briefing to look into and understand a bit more. This is all about us trying to work together to speed up the turnaround time for tests, because that is crucial. And we have done that when there have been problems before. I hope we will do that in this instance as well. And the Scottish Government is trying to use our NHS capacity to help the Lighthouse Laboratory capacity as well. So we are in the process, as you've heard me talk about before, and we're almost 30% of the way through this. We are transferring our routine, regular, weekly care home tests from the Lighthouse labs into NHS Scotland labs to free up more capacity in the UK-wide system. So as I say, I've got no interest in getting into a spat with anybody about this, but it is vital equally that I am straight and transparent about my understanding of where any issues are and what we're doing to sort those out. And that's what I will continue to do. Fiona.
Okay, thanks. So the Scottish Government published a framework for supporting people through recovery and rehabilitation from COVID-19, and that was heavily supported by allied health professions across Scotland. So we know about long COVID, and the good news is for most people this passes, and whilst we would all think we would recover after 5 or 10 days, we know that some people are continuing to have breathlessness, pain, tiredness and some mental health and psychological problems. So in this framework it gives direction and support to boards as to what services that we would expect them to provide for people post-COVID. So services such as physiotherapy. We know that from a mental health perspective, some people are struggling, and we have invested in mental health services over recent months as a consequence of that. Our occupational therapists are working out of GP surgeries who can play a big role there. And in addition, we're using the Louisa Jordan Hospital, for instance, for people to attend for physiotherapy. So there's the framework there, directing boards about the services to provide, and a range of services are available for people, and we would encourage those who are suffering from what they think is long COVID, but certainly haven't recovered as quickly as they can from COVID, to contact the primary care services and onward referral for that as well.
Thanks for that. Ian McInnes from BBC.
Afternoon, First Minister. A 2-week circuit breaker or fire breaker has just been announced in Wales, with people told to stay at home. Does that remain a possibility in Scotland, or has the time passed for such a measure, given some Scottish schools are already returning after the October break? And just secondly, if I may, how seriously are you considering school closures as part of your tiered approach that you spoke about last week?
I had a conversation on the phone with the First Minister of Wales earlier this morning. He gave me a briefing on what I think he's just announced at his own press conference, which is, and it's for him to set out the detail, but what he described to me is a 2-week circuit breaker, which is effectively a lockdown of the same severity as the one that was imposed back in late March this year. You know, it's for the Welsh Government to take the decisions they think are required, and they're absolutely right to do that if they think that is required. We continue to keep all options under review in Scotland, as we always will. I think it's important to say that we are not starting right now from the same position as Wales. We have had, over the period when our schools have been closed, significant restrictions in place that have not been in place in Wales. So we've had, we have a different definition of household to start with. Wales is as I understand it, much more expansive. We have also had, which they haven't, the restriction on people going in and out of each other's houses. And of course, for the last 10 days almost now, we have had, which they haven't had, quite substantial closures across our hospitality sector, particularly in the Central Belt. So we have already taken measures which until now they haven't taken. So we are in a different position already. We have to, over the course of this week, decide what the position will be across Scotland, and whether it will be the same in all parts of Scotland or whether there will be variations in different parts of Scotland when the temporary restrictions on hospitality are due to expire on Monday, the 26th of October. As I've said before, you know, it is not realistic to expect that we will go back to normality at that point. For example, the household restrictions will continue to be in place, I think, for the foreseeable future. And it may be that we need to have some further restrictions over and above that. And these will be discussions that the Scottish Government is having over the next couple of days with our clinical advisors. And as we set out our new strategic framework towards the end of the week, we will also set out what measures and restrictions we would intend to be in place from Monday across Scotland. And you know, they may be nationwide restrictions, or they may, as is the case right now, be restrictions that vary in different parts of the country. Obviously, we continue to look carefully at other parts of the UK and indeed at other countries. The Republic of Ireland is, as I understand from commentary in the media, likely to announce significant additional restrictions later today as well. So we continue to look at that carefully, but fundamentally assess the position here and take measures that we consider to be necessary, but also that are as proportionate and targeted as we are able to make them. And in terms of schools, our objective as far as possible is to keep schools open, because we know, having had months of being away from school, it is overwhelmingly in the interests of young people to be back at school full-time, learning, interacting as much as possible with their friends and peers. So we, all along, since the schools went back after the summer break, have said that much of the other things we're doing to try to suppress the virus are about trying to keep schools open. Obviously, that has to continue to be assessed, as if we do see a continuing acceleration of the spread of the virus, and if we have a tiered approach, the further up a tiered approach you go, then considerations about what that means for schools will be ongoing. But our objective, as far as possible, is to keep schools open, because I think that is in the overwhelming interests of children and young people. Alan Smith from Bauer.
Thank you, First Minister. Just to follow on from that point about schools, the EIS Teaching Union is today calling for clarity over what could trigger school closures. I know you were saying there about the different tiers. Within the strategic framework being published and this tier system, will it detail what would be the trigger point for when you would consider closing a school, either locally or nationally? The General Secretary, Larry Flanagan, says giving parents, pupils and teachers just a few days' notice would be woefully insufficient. So how do you kind of combat that, and how do you give people that notice in terms of the detail as to when a school might close?
I think the first thing I need to do, which I've tried to do all along, is be candid. There is no perfect approach to this that allows us to, look at data one day and predict a week from now what the situation is going to be because of the nature of what we're dealing with. But part of the reason for moving to a tiered approach is to give people greater certainty. If the virus is at this kind of level, here's the restrictions that will be in place. If it is at another level, then here's the restrictions that will be in place. And we will set out, when we set out the levels, we will set out the basket of metrics that will be used to assess whether a part of the country or the country overall moves from one level to another. The caveat I have to put on this is that will always involve a degree of judgment, and that degree of judgment will also apply to whether, if you are in one level, schools continue to open normally, or whether there is a move to blended learning. And the reason why there always has to be that degree of judgment is you can have, and we had discussions about this going back some weeks when I was trying to explain why we had a different approach to a lockdown in Aberdeen from the one in Glasgow, because there will often be different factors driving transmission. So you could end up having the same case rate per 100,000, for example, in two local authority areas. But in one local authority area, that may be driven entirely by a factory outbreak that you contain in a very different way to how you would contain an outbreak that is much more community transmission driven. So we will look at metrics, we will look at triggers, but there always has to be a public health informed judgment applied to these things, and that will be true in any decisions we make about schools as well. And the tiers level, I hope, will bring some greater clarity, but because of the nature of what we're dealing with here, I don't think I would be doing anybody a service to say that you ever will get to a point where it is absolutely hard and fast definitive that if you've got X number of cases in this area, Y happens. There will be always a degree of judgment and decision making involved in that. Jack Foster from Global.
Good afternoon, First Minister. It's exactly 4 months since you launched the Scottish Government's Facts campaign. We've been speaking to Public Health Professor Linda Bald from Edinburgh University. She says it's a good campaign with all the key messages covered, but the complexity could be why it's not sticking in people's minds as it perhaps should be. On that, we've been asking people today to recite it, and very few have managed to actually get it right. According to the government's own research, I think only 46% of people who'd seen the ad campaign were able to name the acronym, never mind what the letters stood for. Indeed, one person that we spoke to thought that the C perhaps stood for compromisability. Reflecting on the past 4 months, how effective do you think the Facts campaign has been? And do enough people know what it stands for? And will you look at what Professor Bald is suggesting, taking on board going forward?
I always listen to Professor Bald. I think she's one of the voices in Scotland right now that everybody should listen to, because she talks a lot of sense and is a very important critical friend of government and others as she tries to advise us, or she doesn't formally advise us, but in a public communication sense, advise people of the things to do. Look, is Facts successful? I think broadly, yes. I think by and large, most people know the things they are meant to do. But one of the reasons I stand here every day is because I'm not complacent about that. And, you know, if I may say so for the media, I think there's always a balance to be struck between reporting on confusion or lack of knowledge and perhaps contributing to that. And that's not a reflection on your question by any manner of means. But I don't take any of these things for granted, which is why I've not decided to stop standing here every day and reminding people of it. So, you know, I'm less bothered about whether people can run through the 5 things in order and know exactly what every letter stands for than people knowing that you should wear face coverings and wash your hands and clean surfaces and keep 2 metres distance. But we have to keep at that, and we have to look at different ways to get that across as time passes. All of us become inured to messages that we hear day in and day out, so we've got to think about different ways of communicating things, and that is part of the review that we're doing right now leading up to the strategic approach. But everybody's got a part to play in this, and you know, that applies to government, it applies to businesses, it applies to, you know, organisations the length and breadth of the country, it applies to everybody as individuals, and it applies to the media as well. We've all got a vested interest in people knowing what they should be doing in that basic sense and actually doing it. And I'll continue to take my responsibilities for that very seriously and continue to find whatever ways we can to get those public health messages across to people in as straightforward, memorable and effective ways as we possibly can. Neil Pooran from PA.
Thanks, First Minister. If I can just pick up on something you mentioned in your answer to Gordon earlier there, the reports of problems with the texting facility that the UK government runs. Are there any concerns that this might lead to delays in contact tracing, as with the other issues that emerged over the weekend? Thanks.
Well, I said to Gordon that I couldn't give any more detail right now because I'd only been given the information. Maybe the lesson is I shouldn't mention these things at all unless I'm able to give all the detail, but I'm trying to be as transparent as possible. So once I get the opportunity after the briefing, I'll be trying to get to the bottom of that. Any delay in getting test results, though, into our case management system, which is why we take this so seriously, then potentially delays the start of the contact tracing, because contact tracers need to have the detail of the person who's tested positive before they can contact them, get their the details of their contacts and then contact the contacts. So that's why the turnaround time from people being tested to getting the test results into the system is so important. The next bit is actually working really well. The success of our contact tracers once they have the positive test, contacting a very high proportion of index cases and close contacts within a reasonable period of time is actually working very well. The bit that we have intermittent concerns about, and I think that's the way of describing it because it had improved significantly and we've got a concern again over this weekend, is that turnaround time from the test to the test result going into the system. And that's what we continue to explore with the UK government and play our part in trying to resolve as much as we can. Conor Matchett from the Scotsman.
Thank you, First Minister. Just to pick up on testing as well, if that's all right. I'm wondering why more hasn't been done by the Scottish Government to move more regular testing or testing in general into NHS labs, given, as you call them, the intermittent concerns with the UK process, which presumably means that it's not working properly often enough. And if I may, you mentioned earlier that further restrictions might be needed towards the end of the month. Could you provide examples of what those might be? And could you also give us an update on any potential cross-border travel ban?
On the further restrictions, no, I will give my view on that once we've gone through the normal consideration and come to decisions rather than speculate. But I think everybody knows the kind of restrictions that are, as we've said before, we think are most effective in reducing the interaction between different households. It helps reduce the spread of the virus. On travel restrictions, that will be part of our consideration over the course of the week, whether as part of the package of measures that we need to have over the next period, more stricter travel restrictions than the ones we have at the moment are required. And again, we'll report on that later in the week. On the testing point, which is a legitimate question, the UK system is an integrated system. So it's not just the Lighthouse laboratory system. It's many people watching will already have experience of this. If you wake up with symptoms and you book a test, then you're booking a test through that system. The test sample then gets taken to a Lighthouse laboratory, processed and then communicated through that system. So you can't just pick one part of that system to hive off easily. And we made decisions at the outset, as other UK nations did, that integrated system UK-wide, in terms of economies of scale, the efficiency of it, access to the consumables you need, that was the right way to do it. So you cannot simply just pick off pieces of that, but we are working to try to integrate as we go along the NHS Scotland system into that, so that it does become more possible to transfer from one to the other. And what we started with, because it is quite a discrete part of the overall testing approach, is the care home testing. And that's not insignificant. We test every single week between 30 and 40,000, usually around 37,000 people who work in care homes every week. So that is a big chunk of testing that we are in the process, as I say, almost 30% of the way through, transferring from the Lighthouse lab system to NHS Scotland. And the more we can which again we cannot do unilaterally. We need the UK government to work with us, which it is doing. The more we can make those two systems interoperable, then the more we can look to flex between the two in future.
So, sorry, First Minister, does that mean you're stuck with a system that doesn't work then? No,
that's not what I said. The system does work. We have intermittent frustrations around the turnaround time for testing. But the system does work, and I'm not going to stand here and suggest otherwise, because that wouldn't be the case. But equally, I'm not going to shy away from being open and upfront when we're having frustrations about the speed at which a part of the system is working. I've done it before. We've worked with the UK government to resolve it, and we will do the same this time. But people should have confidence in the testing system, both in the testing part of it and in the protect part of it, which is our contact tracers getting to work once positive results go into the system. Mark McLaughlin from The Times.
Hello, First Minister. It was confirmed today that Police Scotland can access details from the Test and Protect system. It says so on the Scottish Government website. Behavioural scientists say this is a surefire way to discourage people from complying with contact tracing, including Stephen Reicher, who's on your COVID-19 advisory committee. So why have you done this?
Routinely using the police to enforce our test and protect system, as Shirley-Ann Somerville was here with me last week and talked about how we will make information now available to local authorities so that they can do support phone calls to people to give people positive, proactive support to self-isolate. We have actually decided, and this is just a different conclusion we've reached from the UK government, that we don't want to go down a heavy enforcement route. We keep all of these things under review, but we do think there is a danger of it being counterproductive, and people who might feel that getting tested and testing positive almost puts them into an enforcement potentially criminalising them, that may make them less likely to get tested. So we are putting the focus on support for compliance, partly through the support payment, but also this new proactive outreach system that local authorities are putting in place, which is starting with the most vulnerable, but will be extended to other groups in the population over the coming weeks.
Follow up, First Minister. You said you're not routinely giving details to the police, but can you confirm that Police Scotland can access details upon...
I will come back to you with the precise chapter and verse on that, but it is not the case that we are handing the details to the police. That's not the approach we've gone down here. We're going down an approach for supporting people to self-isolate. But I'll make sure you get a statement giving the different ways and the different people to whom information from the Test and Protect system could be shared, so that there is no room for doubt about that. Christine, sorry, no, I missed somebody. Derek Keeley from the Courier.
Thank you, First Minister. Many of the usual Remembrance Day services and events have been cancelled in Dundee this year because of coronavirus. However, Rally for Independence is set to go ahead in the city at the end of this month. Given the restrictions on remembrance events and people just meeting up in general, do you think it's appropriate for that event to go ahead? And what message would you have for those thinking of taking part? Are they putting the health of themselves and others at risk?
I'm not sure which event you're talking about. I don't have an awareness or knowledge of it, but generally everybody should be complying with the restrictions on gatherings right now, because that's in the interests of the health of all of us. So there are no exceptions, in my view, from that. There's very good reasons why large crowds of people should not be coming together right now. I stand up here every day and I say avoid crowded places, and that applies. Unfortunately, that will mean that a lot of traditional remembrance services do not go ahead, not just in Dundee, but across the UK this year. Hopefully we will find other ways to commemorate those who have given so much for our collective safety down the years. But big gatherings are not a good idea right now, and of course there are restrictions on them, and that applies across the board.
Minister, just to come back in there, just to clarify, it's all under one banner, Rally for Independence, that's being held on the 31st of October. I know you've kind of suggested in the past that you'd be concerned about some of those going ahead. So do you think this particular event should go ahead?
I don't know how to be any clearer. I don't think big events should be going ahead, no matter what they're for. And I've been clear about that all along. I don't have the detail of maybe I do have it somewhere, but I'm not entirely sure which event you're talking about. But, you know, I don't think anybody who has listened to me over the past, 6 months now can be under any illusion that I don't think big events should be going ahead right now because of the reasons that we all know and understand. And if what you're trying to do here is get some suggestion that I'm going to have a different view of a pro-independence rally than I would have for some other, then that's not the case, because the virus will spread regardless of the political affiliation of the big gathering that might be taking place. So the rules on gatherings apply across the board, and I really couldn't be any clearer on that. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on the new regulations for face coverings in workplaces which are now in place. Do these regulations apply to teachers in schools, and should teachers be wearing face covers in dinner halls, staff rooms and corridors, for example?
There is already guidance in schools about face coverings, and in secondary schools has been in place for some time about the use of face coverings in places where people are coming together, and that already applies in corridors and communal places in schools. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just wanted to ask a quick question on research that was cited earlier this month by Scottish Government advisors, which said that compliance with self-isolation and quarantine rules was just 23%, but it's emerged that the sample size for that was small. Does the Scottish Government have compliance figures or estimates for self-isolation and quarantine restrictions? And if so, can you share those with us? And because that sample was so low, is this something you're particularly concerned about?
I don't think it's fair to say it has emerged. We cited the research, and that's because it is the only real research project where there is a firm figure from. I've I think said before that at these briefings in relation to that you know it can't be taken as the be all and end all of this. We don't yet have really solid, reliable data on compliance with self-isolation. That is work in progress for the Scottish Government. We have some indication through our own weekly polling that we do that measures people's willingness to comply with certain measures, but that is not retrospectively looking at actual compliance. So we're looking at ways through the work we're doing to support people to comply with self-isolation, how we can get better data on the percentages of people actually doing it. It is an important aspect of everything we're doing right now, and we cite data that is available, but we never try to suggest that there's not limitations on that data. David Ball from the Herald.
Thank you, First Minister. Going back to schools, you said repeatedly that keeping schools open is your priority, and that's why we've got these extra restrictions on hospitality and sort of household mixing. But given we've seen such surge in cases over the last few weeks, will the same criteria be used in any sort of tiered approach to when schools should close, as we saw in the original decisions to close schools, given we know more about how the virus spreads and schools have blended learning plans? And can we expect school closures to continue to be made on a case-by-case basis rather than a sort of blanket trigger in any tiered approach?
I think it's really, really important that we keep schools open as far as we possibly can, because you know we know that having schools closed or even having blended learning is not as good for children as being in school normally. So we will strive to keep schools open, and within all of the tiers we will continue to take judgments on whether that is possible or not. We've always said that we can't rule out in parts of Scotland or Scotland overall at any stage reverting to blended learning for a period, but we want to avoid that if possible, and that remains a really important objective for reasons that I think are understood by most people. Fiona, do you want to say a bit more about that?
So we know a lot more about the virus now than we did in March. So when we shut down society in March, we were doing that to protect the population because the transmission of the virus was incredibly out of control. What we know now from the work we're doing in Scotland, the rest of the UK, and what we're observing from international studies is that the schools themselves are very low risk, although they do increase R slightly. They are very low risk, and the balance of the improvement in children's chances, children's opportunities, their education, their mental health and well-being is incredibly powerful. The other thing that you'll have heard Chief Medical Officer, National Clinical Director and myself talk about is the learning we have from incident management teams. And although there have been times when either pupils or teachers in schools have tested positive, the number of actual outbreaks within schools across Scotland has been incredibly low. So we have a lot more information, a lot more reliable information to us that helps support that decision making of the ultimate aim to keep schools open as long as it is safe for children and young people, and of course teachers and support staff. And we're confident that we can apply that in a positive way to keep schools open as long as it's safe to do so.
Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. Just on schools, I realise this isn't something you'll be able to be completely definitive about, but do you have a sense, or have you had any advice on what impact the return of schools has had on the spike in cases we're seeing now? I mean, we know a lot of young people catch the virus and don't necessarily display symptoms. I think there was one of the universities in Newcastle, I think, nearly 800 tested positive and only 10% actually displayed symptoms. So I'm just wondering, what's your sense of how much of an impact schools reopening has had on the sort of high cases we're now seeing?
Fiona will want to add to this. I don't think the reopening of schools has had a hugely significant impact on what we are now seeing. It will have had some impact. I don't think I would stand here and say otherwise. But if you think in the days when schools went back, when we had a very significant spike in the numbers of young people being tested, the numbers of positive cases were very, very low. And we still believe there is none, but very limited instances of transmission within schools. There will be transmission associated with schools that will lead to schools or classes within schools being closed to self-isolate, but we don't have widespread evidence of transmission within schools, but it is important that we continue to make sure all of the precautions and mitigations are in place.
And I think, again, learning from our incident management teams, there was no significant spike when our schools went back. There are other opportunities for that virus because it's our behaviour, it's all of our behaviour that helps the virus be transmitted. So when schools go back, people will perhaps back in the workplace, and therefore the importance of following the rules in terms of face coverings, cleanliness, cannot be overestimated. But actually the return of schools gave a very minimal impact to the rise of R compared to the turn of our HEIs.
Richard Percival from the Daily Express. Richard, you're on mute.
Thank you, First Minister. Can you hear me now? The leader of Orkney Islands Council said over the weekend that they were at an economic disadvantage to the rest of Scotland because of COVID, and now want alternative lockdown or quarantine measures for the Scotland's island communities. Have you had discussions with any of the island councils on looking at alternative measures, and are you considering these at all?
The Islands Minister, Paul Wheelhouse, has had discussions with our island authorities. I've spoken about this quite openly in Parliament. Our islands are in, for obvious reasons, a different position. I think we've got to be very cautious about saying that there is no risk to them of COVID. All of our islands have had cases. The Western Isles has had quite a significant outbreak in the last couple of weeks. Orkney and Shetland, even in recent days, have had cases. So we can't be complacent about the risk in our islands. But we know, certainly in Orkney and Shetland, we don't have the same increase in cases as we've seen in mainland Scotland, and Western Isles obviously had the outbreak that I've referred to. So we do need to, on an ongoing basis, consider whether we want to take a different approach to islands. Like anything in relation to this virus, though, and how we manage the virus, there are trade-offs. If we wanted to have a situation where restrictions in place on mainland Scotland were not in place in the islands, that would probably necessitate more strict travel restrictions between the islands and the mainland. So there is always a trade-off to be made, and it's why it's important that we continue to listen to those on the island authorities, and not rule out anything, and that will continue to be part of our consideration in the period ahead.
No, I think as the First Minister says, it's easy sometimes to be seduced into thinking areas of low transmission are not at risk, because it very much depends on travel. As we've heard already today, sometimes there can be asymptomatic carriage, so it does need to be looked at incredibly carefully. But again, we have quite a lot of intelligence, quite a lot of data that will help us guide that decision.
That concludes the questions today. Thanks to Fiona and to Jill for our BSL interpretation today, and to the journalists for joining us. And thanks to all of you, particularly for bearing with me through quite a technical update today. And thank you for continuing to comply with everything we're asking you to. Please remember facts. We've had a discussion today about whether people do understand facts and do know the things that they do, which is why I will take every opportunity to remind people, please remember to wear a face covering when you're out and about. There are many enclosed spaces now where it is the law, but my advice would be, when you're out, wear a face covering, because it helps to protect others from you if you have the virus, and if other people do it, you get some protection. Avoid crowded places. For whatever reason, if you turn up somewhere where there's a crowd, leave and go somewhere else. Clean your hands. It's really important. Hand hygiene is always going to be one of the key foundation measures that we can take to help stop this virus spreading. And remember, the virus can hang about on hard surfaces, so clean them as well. Distance helps, so keep a 2-metre distance from people in other households, because the further away you are from people, the less possible it is for the virus to jump between you. And self-isolate immediately if you have symptoms, and book a test. I will continue to update you over the course of the next couple of days on any ongoing issues with the testing turnaround times, but I hope that improves over the next day or so. So please keep doing all these things. Stay out of other people's houses, because that is a key way of stopping the virus spreading. And thank you for all of your cooperation. I'll be back here tomorrow at 12:15.